King Faisal Hospital is a world-class entity, organization that serves tertiary healthcare. Over the past decades, it established itself as a leading organization as it serves multiple medical services such as oncology, cardiology, organ transplant, neurology, and much more. What really sets King Faisal Hospital apart from the others is their patient-centric approach. We had struggle with the data integration and management for the patients receiving oncology treatment, which makes it hard to pull reports and generate data about the organization optimization processes and getting enough data to probably enhance our processes. So reporting was a problem because everything was on paper and it was extremely difficult to extract these data. Oracle Health Oncology module had a huge impact in improving patient safety. Having a centralized patient record that everyone can view and the communication is getting much better than on paper chart. Having centralized care plans and readily accessible for these providers has tremendously increased patient safety by standardizing these care. In addition, we don't want to overlook the significance of the oncology flow sheet that provides a very comprehensive overview of the patient oncology-related information. That includes labs, diagnosis, vital signs, regimens, and much more information that can really help the provider from one view to quickly assess the patient and plan his next treatment for the future. As a pharmacist, I'm remarkably happy with the clinical decision support tools that Oracle Health provides for oncologists and pharmacists in order to give them an informed decision or help them make an informed decision during their care planning. Also, we have the documentation tools, which is really important to close the gaps in between the communication between different providers in the same circle, and it really gives a history of the patient, clinical data and information to better help everyone screen that patient and tailor the treatment plan for our patient.